acronym for our agency is EPIC, and originally it came from an old name that we had, the Epilepsy Center, that people kind of elided down to EPIC, and we adopted the tagline then, Extraordinary People in Care. But I think I want to change one word in there. I want to change the in to a do and tell you that extraordinary people do care, because that's something that, as executive director, I see every day.
Peter Egan is a partner with Nixon Peabody and has worked with EPIC Long Island for almost 2 decades, providing expert legal counsel on a wide range of issues.
EPIC is a wonderful resource. They're able to help directly in all sorts of ways, and they're also able to help by providing all sorts of information that you can use outside of the EPIC environment. It's a fabulous place. A lot of these diagnoses do not come with a guidebook, and I found EPIC to be a really wonderful, supportive organization. After years of working as EPIC's attorney, I never thought that I'd be turning to Tom Hopkins and his team as a consumer, but my son developed seizures, and it was wonderful to be able to look to EPIC for help, both in terms of services that EPIC could provide, but also all sorts of other services that EPIC could help steer me in the right direction to help my son.
Dr. Sean Huang is the neurologist with the Comprehensive Epilepsy Center at the Northwell Health Neuroscience Institute.
I'm a neurologist and epileptologist by training. I focus on the care of patients with seizure-related disorders, mainly on medical treatments and decisions regarding surgical treatments. We focus a lot on the science of medicine, on the latest treatments in regards to medications, therapies, and surgeries. EPIC has opened my eyes to also see there are some aspects of patient care which go beyond that, including taking care of patients who have complex social issues, sometimes mental health issues, and housing needs, for example. EPIC has been a really wonderful bridge for patients getting the kind of help they need, oftentimes in regards to social work, mental health care, and patient advocacy and education.
Deborah Risbrook is a nurse practitioner with the Comprehensive Epilepsy Center at the Northwell Health Neuroscience Institute.
One of the things I really do is I do refer a lot of patients to EPIC Long Island. So EPIC Long Island helps me as a professional do my job. They have psychiatrists there that I have referred patients to. A lot of my patients have anxiety and depression. I referred for that reason. Some patients that I have are very young and they're very nervous and they feel like they're the only one that has this entity, and they have support groups at EPIC. So I refer them to EPIC for that reason. A lot of my patients I see all the time, so it's not a one-time thing. I never see them again. So we do develop relationships. And it's very exciting when we actually do find a medication, the right combination of medications that the person feels well on, and they're not having any more seizures. That's like a great thing. I feel very great. When I have all patients like that all day, it makes me feel woohoo!
Monica and Bruce Moser's son Jesse joined EPIC Long Island's residential and dayhabilitation programs in 2014. They spoke with us during a visit to the dayhabilitation program.
Well, Jesse is nonverbal, but his expressions are all on his face. He will tell you exactly how he feels. He has the biggest smile, he's warm. When he's happy, you can hear it in his voices because he has different voices for different feelings. And if you can see it in his eyes. He's just amazing. He's happy.
He's never looked better, quite frankly. In the years that he's been here, we've seen him not only mature, but just become happier and more content. We feel like he's relating more to the folks around him.
Yes.
And just becoming more interactive than he ever was before. So It's been great.
I would tell Jesse, you have 2 homes, one with us and one here. Extraordinary people do care.
Extraordinary people do care.
At EPIC Long Island, extraordinary people do care.
Yes, they do.
Extraordinary people do care. Do one more time.
Keep it up, keep it up. 3, 2, 1.
Extraordinary people do care. Here's a little song called Blackbird for You.